Say what you wanna say.
Hey guys, it's your learning desire. So today we are going to talk about the primary PPH and secondary PPH causes plus diagnosis. So first of all, we will start from primary PPH. Now, what are the causes of it? The causes for primary PPH is divided into four categories, right? First one is tone, uh, second one is tissue, third one is trauma, fourth one is thrombin. So what is the normal mechanism? Now it depends on two factors, right? First one is the uterine contraction and retraction, and which is the most important mechanism which helps to stop the bleeding. The whole stopping process depends on this, right? So when the uterus gets contract and retract, so there are certain blood vessels present which gets compressed, right? So in normal pregnancy, it is called as hypercoagulable state. Why normal pregnancy is called as this state? Because in this period in normal pregnancy there is an increase of clotting factor, so which helps to block the opening site, right? As I mentioned you that first factor is uterine contraction and retraction, and then when there are certain tones present, right, when there is a certain tear or block or opening present, so that clotting factors get accumulate at that particular site, and then it helps to block the opening. So this is the whole phenomena of bleeding stoppage. First cause of primary PPH is atonic uterus. Now atonic is what? When the tone of the uterus gets disturbed. Now it is the most common cause in which is most commonly found in PPH. It is commonly found in 80% of cases, right? So as I mentioned you about the normal mechanism of bleeding stoppage. Now in atonic uterus, what happens with the separation of the placenta, the uterine sinuses which gets torn, right, which gets torn, cannot be compressed effectively. Okay, why it is not compressing effectively? Due to imperfect contraction and retraction of the uterine musculature. That is why the bleeding gets continue. Okay, so now you can relate the normal phenomena of bleeding stoppage with this atonic uterus. Atonic uterus is found in some conditions, like for example it is most commonly found in grand multipara, which delivers more than, right, 5 times, right? So in this case it can be found. Second one is over distension of the uterus. Now this can be found in multiple pregnancy, hydramnios case, and in big baby. Further leads to imperfect contraction and retraction, and can cause PPH. Third one is the malnutrition and anemia. Fourth one is the antepartum hemorrhage, which is further divided into two. First one is the placenta previa, and second one is the abruptio placenta. Now placenta previa is what? When the placenta gets implanted abnormally, right, over the lower uterine segment, and in case of abruptio placenta, when there is a premature separation of placenta occurs, right? So in that case PPH can be happen. Third one is the prolonged labor, and another cause is the anesthesia. Anesthesia is when when these anesthetic agents or depth of anesthesia can cause atonicity, right? Next one is the malformation of the uterus, uterine fibroids, when when the because uterine fibroid cause obstruction, so that is why it further leads to imperfect contraction and retraction. And next one is the mismanagement, third stage of labor, right? अगर डिलीवरी जो है बेबी की पहले ही प्रीमेच्योरली करवानी चाहिए, रैपिड डिलीवरी करवाई या फिर प्रीमेच्योर अटेम्प्ट किया टू डिलीवर द प्लेसेंटा, राइट, पुल किया कॉर्ड को और मैनुअल सेपरेशन किया ऑफ प्लेसेंटा का, जिसके कारण क्या हुआ कि ब्लड लॉस का इंक्रीज ज़्यादा हुआ ड्यूरिंग सिजेरियन डिलीवरी. सो ये सारे फैक्टर्स क्या हैं, रिस्पॉन्सिबल हो सकते हैं PPH को कॉज करने के लिए. नेक्स्ट इज मोर्बिड अधेरेंट प्लेसेंटा. नाउ इन मोर्बिड अधेरेंट प्लेसेंटा में क्या होता है कि डीपली इन्वेजन हो जाता है प्लेसेंटा का, अब ये क्या है कि जिसके कारण क्या होता है कि मे बी इसमें पार्शियल सेपरेशन भी हो सकता है और डिफ़िकल्टी कह सकते हैं कि प्लेसेंटा को सेपरेट होने में भी हो सकती है। सो इन दैट केस टोनिसिटी गेट्स डिस्टर्ब और टोन फैक्टर्स वाली सारी थ्योरी आ जाएगी, ठीक है। सो दैट इज़ वाई पीपीएच कॉज हो रहा है प्रेसिपिटेट लेबर, राइट। सो दीज आर द मेन कॉजेज, राइट। सो एटोनिक यूट्रस में ये जितने भी मैंने कंडीशंस बताई हैं, इनमें सारा क्या है कि एटोनिक यूट्रस में ही सारा कुछ जो है मेनली टोन पे डिपेंड कर रहा है और फर्दर किस पे डिपेंड कर रहा है, second one is depending on the contraction and retractions, right. So this is the first cause of PPH. Now second cause of PPH is tissue, right. As I mentioned you that there are four T's. Second T is tissue. So tissue is what? अब क्या है कि टिश्यू में क्या है कि रिटेन कोई भी पीछे रह गया है, लाइक बिट्स ऑफ प्लेसेंटा रह गए हैं, राइट, ब्लड क्लॉट्स रह गए हैं, फीटल मेम्ब्रेन रह गई है, दैट इज so these are the retained tissues are what causing, these causing the imperfect uterine contraction and retraction. That is why PPH can be occur, right. So third cause is traumatic. Traumatic is when there is any trauma occurs to the genital tract, or which usually occurs in operative delivery, right. If there is a blood loss from episiotomy wound, and if there is a blood loss in C-section, right, 800 to 1000 ml, right. So in this these are the main factors can cause PPH, right, heavy bleeding. So इस चीज़ में ये हो सकता है, and this is most commonly found in 20% of cases, right. So अब genital tract injury जो है that it can be any site, right, in cervix, vagina, perineum or uterus, right. Next one, the cause of the PPH is thrombin. If any blood coagulation disorder is present, for example, platelet disorder is present, so in that case, PPH can be occur. So these are the main causes of primary PPH. So in atonicity, the tone is atonicity of uterus mainly depends on the tone, and second one, it is occurring due to imperfect contraction and retraction, right. And second, as I mentioned you, that tissue, if there is any retained bits of tissue, clots or fetal membranes are left behind the cavity, so that is why these are leading to imperfect contraction and retraction, and which further cause PPH. So these two are the main relating with each other, right. These are the main causes of primary PPH. Now secondary PPH causes are same as primary PPH, but there are little bit difference. Cause of secondary PPH is retained bits of cotyledons or membranes. Second one, if there is any infection present. Third one is subinvolution of the placental side, right. So in that case, if any delay, if any delay is present in healing process, so that is why secondary PPH can occur, right. So if any secondary hemorrhage is present, secondary hemorrhage from can be cesarean section wound, which usually occurs between 10th and 14th day, right. So these are the main secondary PPH causes. Now what is the diagnosis of primary PPH and secondary PPH? Now in case of primary PPH, the mostly vaginal bleeding is visible outside, and rarely bleeding is concealed, or there is a broad ligament hematoma is present. And third is alteration of pulse blood pressure, as in definition I have mentioned in part 1 video, that it is evidenced by fall in blood pressure and rise in pulse rate. Next is hypovolemia state may be occur, and death may be occur, and in traumatic hemorrhage, the uterus is well contracted, and in case of atonic hemorrhage, the uterus is like flabby, right. So this is the main difference in which is helpful for to diagnose that is it atonic uterus or what, right? So next one is a secondary PPH. Now in case of secondary PPH, the bleeding is bright red, and it is depending on amount, right? And as I mentioned you that in cesarean case 800 to 1000 ml above blood loss can be occur, so it is considered as secondary PPH. Next one is the rarely it can be brisk, and there is a varying degree of amount of anemia may be vary, right? And evidence of sepsis are present, as I mentioned you that in case there are the secondary PPH causes are infection, so in diagnose evidence of sepsis can be present, and internal examination also reveals the sepsis. And further ultrasonography can detect the bits of placenta inside the uterine cavity, right? So these are the main diagnoses of primary PPH and secondary PPH. So in today's video we talk about the primary PPH causes, as it depends on four categories, right? There is a tone, tissue, trauma, thrombin. Tone depends on, as I mentioned you, atonic uterus, right? And tissue, in case of tissue and in case of tone, there it mainly depends on imperfect contraction and retraction. Trauma, it depends on genital tract injury or blood loss from cesarean section, right? So in thrombin depends on the coagulative disorders, right? So this is the primary PPH causes, and secondary PPH causes are same, but there is a little bit difference. And last we discussed about the diagnosis, primary PPH and secondary PPH. So I hope you will get to know about this, and please like, share, comment and subscribe my channel. Thank you.